My name is Mary Schranker. I'm the Children's Behavioral Health Statewide Coordinator for the Department of Children and Families with the Substance Abuse and Mental Health Program Office. So it sounds like a fancy title. Really what I do is I have a number of grants that I am in charge of, and it's a new position that was created last year in trying to, we kind of, and a lot of what I'll talk about in this presentation is we really blew our system, our whole children's mental health system of care. We really blew up in the last 7 years. And so now we're kind of going to get back to having some key people that are looking at children's issues around the state. So, hi. So what I'm going to talk about a little bit is about the structures. We've got multiple agencies that are involved in providing behavioral health services. The system includes mental health and substance abuse services and reports. And there's multiple state agencies, local governments, and most of it is provided through contracts with service providers in the local communities. Multiple funding streams are involved, from local funding, state funding, and federal funding through the Substance Abuse and Mental Health Administration, and then other areas like Medicaid. And then the services and supports are provided in a variety of community-based settings, as well as some residential settings. So there's a number of state agencies that are involved in providing behavioral health services, both for children and adults. And the two primary ones are the Agency for Healthcare Administration, which is the Medicaid agency, or ACA, and then the Department of Children and Families Substance Abuse Mental Health Program Office, SAMH, through state and federal funds. Medicaid is all completely, well, it's not all federal because the state has to match it, so there is some state money in there as well. Secondary agencies that are providing behavioral health services are the Department of Education, the Agency for Persons with Disabilities, Department of Health, Juvenile Justice, Corrections, and then the Department of Children and Families Child Welfare Office through their community-based care agencies. So like the Department of Education, one thing that happened in the last legislative session, I'm sure everybody's aware of what happened in Parkland, the really very sad thing that happened down there. And so there was a bill that was passed and signed into law that provides a lot of money for the school districts to provide behavioral health services within the schools. So I think things are still being kind of worked out exactly how that's going to happen, whether they're going to be hiring staff or whether they're going to be contracting that out with different agencies. So they're going to have some more money in that.
How recent? Like you're talking about recent, like how recent?
The legislation?
Yeah.
Last session.
So,
If you look at it, it's called the Marjorie Stoneman Douglas Act. I think it was Senate Bill 7026.
okay.
Is that right? Okay.
So if our school district is already offering mental health services on a separate grant that they applied for, we just need to find out so our school provides mental health, district provides it under a grant that they wrote and asked for. So my best route would be to figure out what the funding source for that grant is, and then see if it's not this, then they should be providing additional.
I'm not really in a position to answer that. You
Okay.
probably have to talk to somebody locally. Around the state, there's SEDNet. Have you heard of SEDNet?
Yeah.
Okay, so there's somebody probably in your area. There's a
Yeah, we have sent that from
yeah. So there's like a, what do they call them? There's like
someone from my area.
Yeah, there's somebody, a SEDNet project person or
Yes.
something. They're going to have much more information than I would.
On the new bill that you just mentioned and how they're going to push into our individual districts?
Well, a lot of that is still being worked out,
Okay.
but they probably are involved in that
Okay.
because each area, each school district is having to decide what exactly they're going to be doing.
Oh, but they could be adding the SROs, same thing.
Well, there's two pieces to it. One is SROs,
Uh-huh.
and then the other is behavioral health services.
Okay, thank you.
So there's it was like multiple kind of pots, so to speak, of money in there, because there is a whole piece about that, about SROs, arming teachers, and that kind of thing. And then there's the behavioral health aspect.
Okay.
So I would suggest contacting your SEDNet person, and because they hopefully are involved in whatever planning is going on. I mean, it was passed into law in like April,
Okay.
so they're still in the planning stage of trying to figure out exactly what they're going to be doing. So kind of going to the two main funders of behavioral health with the Agency for Healthcare Administration. In 2011, we started the process of going from what we call fee-for-service, where you had your Medicaid card, you go to a Medicaid provider, and then they can provide services for you. And you kind of pick whoever you want to go to a managed care. So the managed care program has two key components of managed medical assistance, or MMA, and then the long-term care program, which is for nursing home care. So there are a number of different managed care organizations or health plans around the states, and that provide, so within any given area there may be one or more plan, and Medicaid recipients enroll in a plan, whatever they have available. And then that plan has a network of providers, and they're supposed to be providing all of the behavioral health services that are part of what's called our state plan that has been authorized by the Centers for Medicare and Medicaid Services. And
What about straight Medicaid?
the fee-for-service?
Yeah, like if you're not on the HMO, you just have straight Medicaid? Is it the same process?
If you're the fee-for-service, which is a very limited population, but yeah, with that, then you just go. You'd have to know, is this provider able to do that?
Okay.
Because with the movement to managed care, there's been changes within provider enrollment, where providers don't have to be what's called fully enrolled to be part of the managed care network. So you have to find a provider that's what's called fully enrolled for them to be able to actually directly receive Medicaid services. So whatever provider you're thinking of, hopefully will know whether or not they can accept that. So if you'd like more information about the Medicaid managed care program, you can go to their website. And then within the Department of Children and Families, we blew up our system as well, starting back in like 2010, and the legislature directed us to create what's called managing entities. So the managing entity, we have 7 of them around the state, each has a specific area that they serve, and they're responsible for the day-to-day operational delivery of behavioral health services for children and adults. So they are supposed to be looking at, what's available, what needs are, and trying to develop services if they're not available.
Is that that's like Lutheran Services for me?
Yes.
Okay.
Yeah. So Lutheran Services is one of our managing entities.
Okay.
So the managing entities then contract directly with the providers. What we used to do before we had managing entities is our local offices, our regional offices, did all the contracting with the providers. So now the managing entities do all that, and that's for all of the services, prevention, which is primarily for substance abuse, and then treatment services and supports within whatever area that they serve.
And how do you find out who your managing entity is?
Well, I'm glad you asked that question, because guess what? Here you go. So this is available on our website, myfloridafamilies.com. You go under mental health, and then you go under, let me back up and go. You go under, I think it's programs. I think it's under like 4 providers. But I think if you just got onto our website and typed in managing entities, you can get to this. So to kind of walk through how this goes, because this is showing a couple of different things. The Department of Children and Families is divided into first regions, and so each region is shown by the pulling out. So each kind of pulled out area is a region. And within each regions, we have one or more circuits. These are judicial circuits, because a lot of what we do is in the child welfare realm and with the involving the judicial circuits. So those numbers on here, 1, 14, 2, and so forth, that indicates the circuit number. And then within each circuit, there may be one or more counties. So some counties, like when you come down to Miami-Dade, that's a circuit all in itself. But when you look at Circuit 20, there's a whole bunch of counties that are part of that circuit. So that's the region circuit. The managing entity is identified by the color. So in the blue area of North Florida, Northwest Florida, we have Big Bend Community-Based Care is our managing entity there. In the yellow, that's Lutheran Services. That kind of a orangey color is Central Florida Care's health system. And then coming down the maroonish is Central Florida Behavioral Health Network. The pink over there with Palm Beach and Indian River area 15 and 19, that's Southeast Florida Behavioral Health. Broward has Broward's its own everything, kind of. It's its own region, it's its own circuit, and it has its own managing entity, which is Broward Behavioral Health Network Incorporated. And then south, in the southern region, we have South Florida Behavioral Health Network. So these are the managing entities, and they're the ones that are responsible for the service delivery system using the dollars from the Department of Children and Family that are from state and federal funds. So the managing entities, and you can also, within this on our website, you can get to a link that goes directly to the managing entity website. Each of them has a phone number on there that if you have any questions about what might be available in your area, that would be the place to call.
You said this is the concept that's like relatively new in the past, like the managing entities part is in the past 5 to 7 years?
Yeah, so I don't know if you can see it, it's too small, but so 2010, October 2010 is when the first one came online, and the others were all throughout 2012, and then Big Bend in 2013.
So I have a question. I am very familiar with mine, Lutheran Services, and I wish I could remember how I got there. I think it was probably from a case manager from Baycare or something.
Mm-hmm.
But across the state, just in general, when you're like talking to other parents or helping other parents, how do people typically get a referral to their managing entity? Like, so mine was like through FSP meetings, like, so for placement for my child. So I just have found it as like a hidden gem. Like, they do everything for me that I couldn't do myself, and or there's no more nothing. There is, like, Medicaid pays, my kid's been in sick, my kid's been in group home, but Lutheran Service has done everything. And then when he comes home, it's like, okay, well, what does he need? Oh, your insurance doesn't pay for that? Okay, well, this is what he needs. This is what he needs to be successful to reintegrate back home. Like, but I don't want to send, like, how do you know when it's time for someone to have a referral to the managing entity, like, on top of the services they're getting, like, just from their MMA, I guess?
Yeah, so the managing entity contracts with providers. So you may be receiving services from a provider who is both a Medicaid provider and a provider for the managing entity. And so they may refer you to something else.
Or not a Medicaid provider, but a managing entity provider, so that my kid can get services to essentially prevent a change of placement. Yeah. Okay. Yeah. Which is what happened. I'm just saying, how do you, like across the state, how do you know when it's time for someone to be using their managing entity, versus? Yeah. So I think at it kind of happens, I think, at the provider level. Because so if you have a case manager, from Baycare.
Then your case manager said, okay, I think this is a service we need. Let's see who can provide this service. Oh, Medicaid doesn't pay for this. Let's see if we can find somebody, and if they have a contract with the managing entity, and if we can do that.
Okay.
So now the funds that we have for services, as with everything else, we have a pot this big, and we need a pot this big. So the managing entities also have to prioritize the funding for services, because when it comes down from, there's what we call a block grant that comes from the federal government. And it doesn't say you need to do this percent for adult substance abuse, this percent for adult mental health, and then this and this for children. We used to have that, but we don't anymore. And so that it's the managing entity's responsibility to kind of prioritize that. So there are also within Medicaid, there are some, it depends on your plan if they've done this, but there are some things that are called in lieu of services that a plan can develop a program around and say, and then they go to the Agency for Healthcare Administration and say, okay, we want to do this instead of, say, therapeutic group home. So to keep a kid in the community, we want to be able to do this.
So like
then,
while you're sitting waiting for EQ help to like wake up and give you your ABA, then you're saying that MMA could be doing like in lieu of like something else.
possibly. You have to check with like what that plan has available, but there's there may be something that's kind of an alternative sort of thing that may be available. I don't know, but. So the population, each agency that's providing behavioral health services has a defined population, and that's based on state and federal requirements. So in order to spend this money, it has to be spent on, a certain population. So the target population for us, for the Department of Children and Families, is defined in statute. There are also some projects that have kind of a direct funding from the legislature where they define who that population is. And we may have grants that serve a certain population. So there may be some, we have kind of a wide population, but there may be some programs that have a more narrow focus on who can be served through that. The Agency for Healthcare Administration defines eligibility for Medicaid, and that's covered in their provider handbooks on their website. So who do we serve as the Department of Children and Families? So we're authorized by state and federal law to serve children with serious emotional disturbances, children with emotional disturbances, children who are at risk of developing emotional disturbances, adults with serious mental illness, including those that have forensic involvement, criminal involvement, persons in crisis, because we license crisis stabilization units, and persons with co-occurring mental illness and substance abuse disorders, or persons at risk of or with or at risk of developing a substance abuse disorder. So we have, under community substance abuse, we have adult and children.
And you're left to fend for yourself. I know I had to interact with my son over Memorial Day weekend, and I end up becoming, I end up abandoning him because I did not pick him up in the 3 days, and, go through the course of them threatening you, you gotta come get him, gotta come get him. Then it turns over to child services for abandonment. But if it's a safety concern where the child is being physical, aggressive, and, threatening my life, like he says he's gonna kill me in my sleep.
Yeah.
What am I supposed to do? Because child services does nothing. I'm to the point where I'm in court and the judge is like, what, you think you can't be a parent? I'm like, that's not what I said. My son needs
some help.
Right.
I can just say for myself, like that's why I was talking about the managing entity being like a secret. So my son was Baker acted 12 times. And then basically what I found is when you so my son went to the SIP placement, like the inpatient psychiatric, he's been there twice. But to get there, from what I noticed is that the places available in the state, I think 12 SIP hospitals, there's like 12 or something. And there's a limited number of beds. And you could go through as a parent, fill out the whole packet, but if you have the managing entity, if you're going to like Lutheran services, we have almost like if your kid has an IEP and you go to school and you have a staffing. Okay, so I go to a staffing with my Lutheran services lady, and she helped me fill out the entire packet, collected his physical, his dental record, his previous and his Baker Acts. And it was rough while I was waiting, But I feel like the managing entities have first dibs on those beds. So like my son went to a place in Bradenton, I don't live in Bradenton, but he went to Bradenton. And she knows when someone's gonna get discharged there and she submits a packet. And I feel like the relationship with the managing entities can get the children into the placements easier. If it's not like DCF foster placement, that I feel like I don't think as a parent, the psych hospital would have taken me off the street as anybody besides Joe Schmo, but the managing entity lady did helped me get her the information to do his packet, and that was the only way. But yeah, as far as emergent care, no, I had to bring him home, Baker Acton 3 days later, bring him home, Baker Acton 3 days later. But as soon as there was a bed,
Yeah, and that is a real
he was
problem that we have. Thank you for sharing that for both of you, that there really are just not enough beds, because like I said, we have a pot this big and a need this big. And we, 7 years ago, we had more of those specialized statewide intensive psychiatric kind of programs than we have now. So if your child has Medicaid, these residential services are primarily funded by Medicaid. So the managing entity does have some funds to be able to do that. So I kind of recommend that you contact the managing entity.
Well,
Do you have any kind of a case manager that's working with you?
I was referred through SEDNet. So they did the emergency staffing, and then I was disrespected by one of the staff members at the staffing because I'm active duty military. So they're like, well, if the mother is just as crazy as the kid, what do you expect? So they help, at all, nothing, and I'm just like, I can show you how crazy I am and jump over this thing, but you're comparing me to a 13-year-old child versus me. I've been dealing with my mental health issues on top of his, and it's not him.
I'm sorry about that. Yeah. But and even if you don't have your own mental health issues, when you're trying to navigate the system, sometimes you look
say
like
you get some. I don't know. I don't know if mine came
like you're
before or
a crazy
after, but you're not alone.
I know. So you look like you're a crazy person.
Yeah.
Because you've been transferred here and there and call here and call this and call that, and by the time you get to
But you
somebody,
get
you're like,
responsible.
and and then you get labeled as the parent as, oh well, it's not the kid's problem, it's that crazy mama.
Exactly, and you have to be crazy to be heard. But then if I hurt him, I'm in trouble not only by CPS but through the military. So I'm sitting here like he could do anything to me and nothing happens. So I'm like, I had to tell the judge, I was like, listen, when I kill him or he kills me, then what? It's gonna be on your hands. And then she just gave me a continuance, but I'm looking like, you're not helping. He needs to be in some type of therapeutic home. All the places that she named, like Youth Crisis Center, the places that are voluntary beds that would take him, he got kicked out of. So I'm like, he needs a higher level of care, but she wouldn't even listen to me. So I'm like,
So the managing entity ought to be able to help you through that process, because there is some paperwork and stuff involved. There are some assessment things that need to happen, especially with the statewide inpatient psychiatric kind of level. But the managing entity should be able to kind of help you with that. You don't have any kind of a case manager other than
the military does, my case manager, but they're at a loss. Everybody's like with their thumbs up their butts because they're like, I don't know, try this. And I'm like, I've tried that. They won't take them. They went as far as not even taking them for Baker Acts anymore when he is so violent, or because he has like all this intermediate explosive disorder and stuff like that, but they're like, well, he's not doing it right now, so you're fine. I'm like, okay, I'm going to be forced to defend myself.
One other resource is the school system. Because if your child's in school and has an IEP and you have an advocate that knows how to advocate, there are placements that can be gotten through the school system if the behavioral issues are impacting them in the classroom. So that's another avenue that you can possibly try and get some sort of residential placement. Because if they're having difficulty at home, chances are they're having difficulty in school as well, and the school system can provide additional services.
Yeah, but sometimes the kid, like mine, he's manipulative. He knows just how far to go so he doesn't get placed somewhere. Like, he knows not to hit a teacher or push a staff member or something,
Yeah.
you know.
So give me your name, your contact information, and I'll have somebody get in touch with you. And see if we can do that. Yes, ma'am.
When you listed peer supports under children,
Mhm.
are you talking about the same concept as what happens with the adult peers? Or are we talking moms helping moms or parents helping parents as peers?
A little bit of both.
Okay, so children, helping children?
More youth than
Uh-huh.
younger people, and so I'm going to talk a little bit more about that in just a minute.
Okay.
So if I
I'll
don't
wait.
answer your question,
Oh, wait.
tell me again, okay?
Can I ask a question? Yes. So the SIP process,
Mhm.
I'm currently trying to do an out-of-state SIP,
Uh-huh.
out-of-state. Because one of the things I noticed, and I know this applies to you, and I don't know what your son's primary diagnosis is, but what I have found in the state of Florida is, if it is autism, there's really nowhere that specializes.
All right, so yes, my kid is autistic.
So I am now going out of state.
So I was gonna tell that mom that too, that I
Yes.
know about.
I'm gonna talk to her
I was
afterwards.
gonna say, yeah, there are. I was gonna say, not only are there very few SIPs, the age of your child and any other diagnoses reduces your SIP placement. So my kid was young,
Yeah.
10, he's now 13, but 10 when we started, and autistic. Now I had a little bit of saving grace because he is higher functioning autistic, so he's not intellectually disabled. But I actually had to bring him there, and they had to see like toileting and some executive functioning stuff. And we did find a SIP placement that had a younger children's unit, which again was in Bradenton, and I was very happy with it. But, you know, at first, the same thing, the managing entity said to me, well, he's autistic, and she said, what will happen is, none of the SIP, the state hospitals will probably take him. She said, but then because they'll deny him, you can go to like private places. So we went somewhere outdoor and whatever, but then he's like too high for that. But we got lucky, and I found a place in Bradenton, but you are right. Yes, my son, it was young and was autistic, and that was an uphill battle.
Yeah.
But I agree with her, I just happened to come about this all completely by accident and lucky, and there needs to be a place for this information
Yes.
for parents, and I am a teacher and a social worker, and I think that is the only reason I'm able to navigate. And I always say, what about people who don't have the resources that I have? How do they make their way through this whole maze? I don't understand it.
Exactly.
Yeah.
Exactly.
You know, yeah,
Yeah.
and it's just, you know, and it's an epidemic. These kids are just behavior, it's an epidemic, and,
There's gonna be more of what has been happening in schools.
yeah.
I mean, because that could have been my daughter. Absolutely, that could have been my daughter.
Yeah. So when we kind of look at the continuum for residential in the children's area, from least restrictive to most restrictive, we have therapeutic foster homes, which are primarily paid for by Medicaid. Under the specialized therapeutic foster care is the Medicaid service. The therapeutic group care, Medicaid services, specialized therapeutic group care. And then within a residential treatment, there are places that are licensed as residential treatment centers, and the statewide inpatient psychiatric program is the Medicaid service for that, and then an inpatient psychiatric hospital. So there's a process involved in trying to place at any of those levels, and if your child has Medicaid, then the managed care plan should be able to help you with that, and if not, the managing entity.
Can I ask you a question? Sure. If you have a child who's on the Medicaid waiver program and enters the SIP, do they lose the waiver?
No, you have to, mine's the same thing for me.
I was gonna say, I
Are you
hope
on the
somebody
wait-
in this room knows the answer.
Are you on the wait list, or you're active on the
No,
wait
we're
list?
active.
All right, so there's APD group homes, and then there's
Yeah.
Medicaid ones, but
Right.
if you can rule out why your kid doesn't, like, I live in Hernando County, like, you probably don't even know where Spring Hill is, and I'm not trying to be whatever, but my child who was 10 doesn't belong in a home with 14 to 30-year-old intellectually disabled adults per
Right.
se. So when we could rule out that none of that was a proper placement, then we would use the state Medicaid SIP homes.
But-
I don't have to use an APD home because most of them are
Right.
combined adult.
And you're active on the waiver?
I am on the wait list, but it's the same thing. If you're active on the waiver, there's APD homes and then SIP, and so you just have to do it like separate.
But can you lose it though? Because somebody told me it has to be less than a year.
How long are you on the wait list?
How long have I been on the wait list?
Yeah. Will
Not
they put you on with these kind of issues?
not very long. As soon as he went to, I mean, I've only, probably 3 years, but as soon as he went to SIP, I moved from the bottom to like category
Are you
3.
on the crisis? The
No, I'm on
crisis
category 3,
list? Why have you not filed for crisis?
because I can appropriately caregive for him. That's okay, they come often, it's okay, hey, we'll get there. He's only 13, they can keep paying, you know, I went to that other class before here, but yeah, you don't lose it, I don't think. You just,
I think it might be, they have to be there under a year, but that's my biggest concern right now is losing that.
oh, because they wouldn't reside in here.
Would everybody mind using people first language rather than autistic children or people with or intellectually disabled? Can we just say somebody with autism? Because they are people first, and then they have autism, and then they have an intellectual disability. But they are people first, and children first, and then we have a disability.
Thank you
Thank
for
you.
reminding us of that.
I know it's shorter to say autistic child, but I think it's more respectful.
So, within the behavioral health system, and I've talked about this a little bit, but we contract with the managing entities to purchase services. So someone who is Medicaid eligible, who's a Medicaid recipient, we can pay for services through the managing entity that are not covered by Medicaid. But we're the funder of last resort, just like Medicaid is. So if somebody has Medicaid, then we would look to Medicaid to pay first, and then we would pay for things that aren't covered by Medicaid. The behavioral health service and support array funded by Medicaid and by us through our managing entities is very similar, but there are some, the things that, for Medicaid, it's got to be a medical necessity. And so there are some things that we can pay for that Medicaid might not say, well, that's not medically necessary, but that we could pay for. There's also local funds are used to purchase services depending on your area. There are things like children's services boards in some areas of the state that have money. County commissions might create programs and things. So I wanted to talk a little bit about some key initiatives that we have around family-focused care. We have what's called Community Action Treatment Teams, or CAT teams. And these is all state funding for these. We received some additional funding through that Marjorie Stoneman Douglas Act, the same one that the school system is getting more funding for, so that we will have a CAT team coverage in every county in the state once we get that rolled out. So that's pretty exciting. So these are team-based, family-focused, integrated, community-based services and supports to youth and young adults. And they have a population criteria, 11 to 21. And then there's some additional criteria. They have to have failed at services. They can have involvement with juvenile justice. I think they have to have had at least one Baker Act. And so then this team of people is providing or purchasing if among themselves they can't provide. They don't have that expertise, they can pay for it. Services to try to help that youth remain in the community and remain with their families. And it's been pretty successful. It's very intensive and they can't carry a huge caseload, so there are some areas where there's some pretty significant waiting lists. And we're hoping to be able to get some additional funds to be able to address that.
Who refers to that? Or who
Yeah,
knows about that? Like,
So those are all contracts with the managing entities. I didn't put it in here, but we do have And I think it's on our website, something that shows where these teams are located.
See, like my son's special needs too, and has a lot of medical, there's nothing in the state. And the managing entity had nothing for me. And so, but the team of people could have at least helped me with resources, you know what I'm saying? So if they can't help me and they can't refer me, then what, I mean, how, I mean, they need to go to the facilities too and make sure that everybody can, you know, shown or can refer out from, you know, hospitals or, you know, wherever. I mean, because there's nothing.
Well, and depending where you are, there may not be a CAT team right now.
Yeah, so.
Because we got some more money last year to add some,
I
but
mean, I talked with people all over the state and nobody's talked about any of this stuff.
about the CAT teams.
Yeah.
And what are they
So-
providing? Like, what are they
So
providing?
the CAT team is composed of a number of different people. So there's therapists, there's a psychiatrist, there's mental health type people. There's also a big component of the program is a youth mentor who works with the child, peer support, and is a huge component of that program. They can pay for some things, as we call incidental funds, for some things like some recreational kind of activities and things to try to help. It's got to be part of the plan. But so they're providing therapy services, behavior management services. They don't pay for medication, but they have to either provide or pay for psychiatric services. And really trying to look at creatively and holistically with what does that child and what does that family need. So if they don't have a member of the team to provide whatever service is needed, then they pay for it.
How does this fit in with wraparound, or is that basically the same thing as wraparound?
It's very similar, and a lot of our CAT teams have been trained in wraparound, and more are going to be trained as we go on. So, and I'm going to talk about wraparound in just a minute too.
Is there a plan to get peer certification for these youth like there is for the adult peers?
The Florida Certification Board, I don't know if they have completely firmed up that, but I think that they are working on a youth certification, youth peer certification. Because they've already worked it out with the adults and what the training is and so forth. So the family intensive treatment, or FIT, this is another very specific population providing intensive team-based family-focused services to families with parental substance abuse that's served by child welfare, and there's at least one child under 8 or under. So the intent here is to prevent removal due to that parent's substance abuse issues or substance use issues, to decrease that, to decrease abuse and neglect, and keep that family together. And these are also not all over the state. I don't know off the top of my head how many teams of these we have. Yes, ma'am.
What sort of outreach is being done to ensure providers are aware of this?
So, yeah, that's a good question. So that's something that, and I'm going to make myself a note of that. So that's something within our managing entities that they, ought to be doing.
Because I worked for an Air Force installation, and this is very common, and like this young woman up here, and I'm not aware of our military treatment facilities being briefed or anything on this.
Mm-hmm. Yeah, and I know we've had some kind of just within our own people up in Tallahassee have had questions like, how do you find the front door?
Yeah.
Right.
And the front door is very different everywhere, and wouldn't it be nice, pie in the sky, to have like a one-stop shopping kind of place, like we have with employment stuff. There's like this place you go, and they can help you write a better resume. They can talk to you about interviewing. You can take little classes on that stuff, help you figure out how to dress for your interview. Just kind of support you along the way. And wouldn't that be nice if we had you just go here, and you talk to somebody about but instead what we have is like sort of this haphazard kind of thing. And you tell your story 48 times as you go to a different person. So,
And then when you end up, going ballistic.
Some consistent outreach on the programs would be great, and I know it's a concern to everybody, as it should be, but even with our military, they're constantly relocating and starting over.
Right. And now they gotta tell their story to yet another person.
And try to figure out that
And try to
system
figure out
again.
that system.
Yeah.
Yeah. I mean, I think I've been involved in the behavioral health stuff for more years than I wanted, but I think that we have come a long way from where we were like 20 years ago, but we still have a long way to go.
That's with everything.
Yeah. Like little baby steps. For pregnant women that are using substances, we have some programs, either residential treatment or outpatient treatment, that provide detox, outreach, residential support, childcare, and some case management to try to support the mother, the children, to decrease the substance use, increase the children's resiliency. So we have some of those programs around the state. So those are kind of some of the family focused things. And then, so this is where we're headed, into a recovery oriented system of care. So we're working with the managing entities on reshaping the system of care into one that's recovery oriented, family driven, youth guided. It builds on strengths, uses natural support, peer support, takes into consideration those cultural and linguistic needs, coordinated across systems and services, and improves the lives of those that are served. So, why recovery oriented? Well, y'all could probably answer why recovery oriented. The focus on wellness and recovery instead of illness and disability. Peer support. Peer support is a huge is something that is extremely helpful when you've got you just don't know what to do. You're at the end of the road, to be able to have somebody to call who has had some lived experience, who has been through something similar to that, or if not completely, who can at least like help you to try to get through it, help you to find that front door, help you to find some services. And families and individuals become resilient by knowing their resources, who to reach out to if assistance is needed in the future. That's why we are really working towards this recovery-oriented system of care. So two of the things that we're doing within the adult substance abuse system, we have been working for the last couple of years on increasing the number of individuals that are providing peer support. So we have someone out of our office who is working on this with all of the managing entities. They all have some person who is designated as kind of in charge of the peer support for that particular area. There's been work with the Florida Certification Board on certification. We've provided a lot of trainings because there has to be, the certification board requires so many trainings and refreshers and things like that. So we've really been working very hard on increasing those number of peers that are providing the peer support. So there are provider agencies who have hired people with lived experience as peers. One of the challenges that we have with that, and something that we're working on, is how exactly do you pay for that? Because the managing entity's pot of money is not endless. And so we're working on it probably more in the child realm than in the adult realm, on Medicaid funding, on having peer support be a Medicaid service. So when I talked earlier about in lieu of services, peer support is an in lieu of service that a health plan can present a plan to ACA for approval on how they want to provide that. Within the children's mental health area, we are focusing in several areas of the state on collaborations with child-serving agencies and providers to include family voice and choice, better coordination of services, using, and including using the wraparound care coordination model that was mentioned. So has anybody else ever heard of wraparound?
They said they were gonna call me. Give her a reference.
So wraparound is a term that is used in a couple of different ways. There's things like, some people talk about wraparound services as like wrapping services around a family. What we're talking about here is a care coordination model that really is very, all of those things from the slide before. So it's all, this is what wraparound is. It's very much focused on being family driven, building on, and youth guided, building on strengths, using natural support. And so we have contracted with someone to provide wraparound training. And what we're trying to do is advance that statewide. We have previously provided some amount of that. And there are agencies and areas in the state where there's a lot of care coordination using the wraparound model going on. It's very similar to, it's like what with the CAT teams that's looking at providing everything they need. Now the wraparound, there's a wraparound facilitator who's the one who's kind of in charge of the whole thing, and then it involves everybody who's in that child's life. Their DJJ, somebody from the school, the therapist, and having a meeting with everybody, developing a plan that's very much specific to that child, that's focused on keeping them in the community. So we're trying to advance that as sort of the model for any kind of care coordination throughout the state. So we have a long way to go with that. We've also been working with managed care agencies on, and there's a lot of work to do there on them paying for that as a service. Because there's a lot of, it's very intensive, and so there's a lot of people who may want to do that, but you know, how do you pay for that? Yes, ma'am.
I've been in the wraparound program, but I felt like it was bad because they did not want to work with the providers that were already in place. So it's like if you didn't have their providers, they were going against each other, you know, instead of supporting each other. So then they started getting attitudes, and it just fell apart because they were competing like for your business instead of worrying about the kid, you know what I mean? And I had to quit the program because I'm like, you guys are not even doing your side that you're supposed to do, but I gotta follow all these rules, you know what I mean? I felt like it was a good idea, especially when it was presented to me, all the paperwork that I had to fill out to go along with it, but they didn't hold up their end of it as far as the parent support or the child support.
So as with a lot of things, there's, you know, they may have been saying that they're doing wraparound, but it sure doesn't sound like it to me. That's like what our old way of business is. Here's my menu. Which do you want? Oh, you want something that's, you know, special orders do upset us. You know, so that sounds like, I'm very sorry for your experience. That sounds like that they really were not doing what is really what wraparound is intended to be. Yeah. So I think what time it is. I think I might have rambled on. I hopefully have not rambled on past my time frame. So, any questions? Other questions?
Hi.
I'm really getting into this because it's so many wonderful
Hi.
seminars. I don't want to catch everything. I wanted to know, did you touch on EQ Health and now how behavioral services are going through EQ Health? And my follow-up question to that is, like, if you have personal care assistant services, why should that?
Hi.
I'm sorry, my loud.
That's
It
okay.
means behavioral services.
So it sounds like that's with the Agency for Persons with Disabilities?
No, this is actually through EQ Health, is through Medicaid.
Uh-huh.
Behavioral services
Right.
is contracted through Medicaid. Once they're under 21, it goes through Medicaid.
So I'm not at all familiar with EQ Health.
Oh, okay, well, that's just the entity that houses it, but
Okay.
I guess I wanted to know behaviorally,
Mhm.
why is it that, okay, once you have personal care through Medicaid,
I don't know anything about personal care, I'm sorry.
AP.
That's
Those
gonna be
are
through the
AP.
agency.
No, she's right,
not.
personal care from
no, that's,
Medicaid.
they have it under 21
Yeah,
through
under
Medicaid,
21.
you don't have to be part of it.
I don't work for the Agency for Healthcare Administration, I work for the Department of Children and Families.
That's why
And
I'm,
so I don't know, I'm not,
because you said Florida Behavioral Health System, so I thought this would encompass, behavior services through,
That's only
Okay.
it's a separate way to
okay.
access.
I'm sorry, I don't know the answer to your question.
Okay.
But if you give me your contact information, I can try to find out
Sure.
for you.
Because that was my concern, about behavioral services. Since my son got qualified for services, I noticed that with the change from Beacon to EQ Health, all of his service numbers dropped tremendously as far as behavioral services, and I wanted to know if they had, or maybe, you know, a contact, or maybe someone else this would fall onto.
So, because like, my base of knowledge has to do with what the Department of Children and Family, do you have a pen? Did you need a pen? What the Department of Children and Families is involved in with behavioral health services. And so
Okay.
we don't pay for personal care.
Okay.
So I don't know, but give me your contact information and I will try to figure out who's the best person to answer that.
Hers is agents, like if you appeal, like EQ Health, that's what happened. Everyone that had like behavior services, like she's talking about behavior, like behavior and analyst services, ABA services. So it used to be through Beacon Health, and then they just use EQ Health now as the new third party that decides is who reviews. So during the transition, obviously there was a million holdups, like continuing people who already had services and then qualifying people who needed services. But there has been tons of legal action just in like the 60 days that they took over. So yes, if you appeal the agency, I know it's like a really long 21 days, but if you appeal the Agency for Healthcare Administration, it literally, in 21 days, you'll have the same services you had before you, like, it's a really long 3 weeks.
Right.
But if you say, hey, on April 30th I had this, then on May 1st, EQ Health took over, and this is what EQ Health said I could have. My kid didn't like meet all his goals from April 30th to May 1st. You will have all the hours you had before EQ Health took over.
And
It's a really long time, it's like 3 long weeks to wait, but
Yeah. And you appeal that through the
Agency for Healthcare Administration because they're managing
I know, and
EQ
what they're
Health.
doing, not only to me, but I talk to other families, what they're doing is, if you have personal care assistant, and you also have behavioral assistance services, they're cutting behavioral assistance services, or they cut PCA, because you can't, they said it's a duplication of services, which is not, because personal care services has to do
Has
with
to have a medical,
ADLs.
has to have a medical
It has to do with
diagnosis.
ADLs,
Yeah, it's
and
not
when
the
you have
same thing.
behaviors plus ADLs, the behavioral assistant is supposed to train someone, which would be the personal care provider. So that disputes the overlapping of services. So here's my
I'm sorry I
number.
can't answer
It's
your
okay, just
question,
call
but let me see if I can figure out who. And what area are you in?
I'm in St. Lucie.
St. Lucie, okay.
They are probably gonna tell you that they both can't be at the house at the same time, but
But they're working on two separate things, because how are we gonna learn how to train the behavioral side? Who's gonna teach them? I don't know, I gotta work.
Did you talk about adults?
I'm sorry.
Did you talk about adults, you know, true developmental disabilities, and now the kid is an adult, like in his 30s? Like, you know, 30 years ago or 20 years ago, they didn't have the care and the diagnoses, abilities that they have now. So my son is now 37 with behavioral problems. You know, where does he go for help? I keep getting the runaround. People passing me from one agency to another. He says, oh, it's not my responsibility. Don't you do it? So,
That's APD.
because, well, it's not APD because he didn't have anything before he was 18.
Well, he did, yeah.
Because
But
they're
he
gonna
didn't-
say it had to be established
Right.
as a developmental disability. If it didn't have an
Before
onset
it was
during
18.
childhood, they're
Yeah.
gonna give her a hard time.
He did, but what they did was just refer him one place and then they just started suspending him from school. They didn't,
Yeah.
so.
So like our providers are, in the adult world, services are much more, are limited to severely mentally ill for adults. So there would have to be a co-occurring diagnosis, so in addition to him being a person with a developmental disability, he would also have to have a mental illness to qualify for our services. So I think I don't know the answer to where you could go for help. You could, and I hate to give you the runaround, and tell you to call the managing entity, because the managing entity is gonna say, well, we can't help. And they probably aren't gonna have any knowledge of what might be available. So I think that the Agency for Persons with Disabilities is probably gonna be the place that, because they would have more knowledge about what might be available than I do, or our managing entity.
When I looked at this and it said that you're covering adults as well.
Right, but adults with serious mental illnesses.
Thank you.
So, I'm sorry.
So is bipolar, is that considered a
Yeah. So you could certainly call the managing entity and see if they have anything, any providers that might be able to help. We have, the Department of Children and Families contracts with managing entities to coordinate behavioral health services to pay for using the dollars that come through the Department of Children and Families. So where do you live? Orange County. So, Orange County is served by Central Florida Cares Health System.
Yeah, I'll go for an hour.
And what is that, like Central Florida Cares Health System? How do you locate that? Is it on the?
If you Google, like that's the,
So
like
if
a
you
company.
Google them,
That's a company?
Yes, so like mine's Lutheran Services, so Lutheran Services is like a company, like an organization, they have their own.
so I
Because,
don't
see-
know if I can get on.
Like, I'll go, when I go upstairs and I'll check it all out, but